Hello everyone. Cool. So today we're going to talk about carpal tunnel syndrome, which is a picture showing here. Let me have a look. Yeah, and I'll talk about it in both Western and TCM perspective. And that's a medium nerve here. So let's start. And this is quite common actually nowadays, especially with those who have computers, using computers, phones, and some repetitive work with stress and office jobs. And that condition is called carpal tunnel syndrome. A lot of people, they might have symptoms like numb fingers and tingling hands, wrist pain, wrist weakness, like always dropping objects, but they don't realize it may actually be carpal tunnel syndrome. So today we will explain what it is, why it happens, and Western medication understanding, also Chinese medication understanding. So how acupuncture helps, and lifestyle, some lifestyle advice, and also what makes it worse. Especially today, I will explain the Chinese medication side in quite simple language, so even people with no acupuncture background, they can still understand. Okay, let's begin. So, what is carpal tunnel syndrome? It happens when the medium nerve gets compressed at the wrist. Now let's simplify that. Inside your wrist, there's a small tunnel called the carpal tunnel. Inside the tunnel, there's nerves, tendons, and blood vessels. So all pass through a very small space. That tunnel is quite small. And the nerve is called medium nerve. So you can imagine once the tunnel becomes tight and the space around the tunnel will be smaller, then the nerve will get squeezed, and then the symptoms will begin. Some common symptoms include numbness in fingers, tingling, and pins and needles feeling, and also burning pain, weak grip, dropping things, wrist pain, waking at night, and shaking hands. That's very classic. Usually, the parts that get affected include thumb, index finger, middle finger. They are mostly affected. Well, sometimes half of the ring finger too. Why it is worse at night? This is one of the most common questions. Many people say, I wake up at 2 or 3 a.m. because my head is numb. Why? Because at night, the fluid accumulates because you are not moving. And again, the circulation slows for not moving. Sometimes wristbands during sleep, this all increases pressure inside the tunnel. Then the nerve becomes irritated. Patients often shake their hand to relieve symptoms. Very classic. That's very classic carpal tunnel sign. What causes it? Well, there are many causes. The first thing is repetitive use. Like what I said, people typing by using computer and a lot of phone use, and those therapists who do massage work and some factory work. hairdressers, they repeat it with the same action. Sweet and driving. So let's make it simple. Anything repetitive that will trigger this. The second thing is the inflammation. Swelling around tendons can compress the nerve actually, so make it inflamed. That can also cause carpal tunnel syndrome, and also pregnancy. So fluid retention is a bit more during pregnancy, which often worsens the symptoms. And of course, diabetes, because high blood sugar can irritate nerves, make it weak, and easier get the syndrome. The next one is poor posture. This is quite important because many people think problem is only at the wrist. Actually, they may also have neck tension, shoulder tightness, poor posture. They can all increase nerve irritation. Going to talk about it in both Western and TCM way. In Western medication view, they say this mainly as mechanical nerve compression. The medium nerve is physically irritated, and over time, nerve conduction slows. Numbness worsens, muscles weaken. In severe cases, thumb muscles also shrink. What if in TCM? In TCM understanding, this part is very important actually. We don't only look at a nerve being compressed. We actually look at a lot of different things, such as circulation, channels, muscles, tendons, qi flow, blood flow, and organ systems. You may wonder, what is channels? For those beginners, think about channels like, pathways of communication and circulation, not just nerves. They involve muscles, fascia, circulation, nerve system function, and in carpal tunnel, the important channels are usually pericardial channel, heart channel, lung channel, large intestine channel. Well, depends on symptoms. It could involve different channels. We have some patterns, which is indicated here to explain this. The first one is qi and blood stagnation. This is usually the most common cases for all pain patients. Things are not flowing properly. Let's put it simple in that way. When circulation becomes stuck, we develop pain and numbness and tingling, especially from repetitive strain, overwork, tension. And this is very common in office workers. The second one is cold and obstruction. That's very common in chronic cases. Symptoms include stiffness, aching, worse in cold weather, hand feels swollen, sometimes worse in morning. In TCM, cold causes contraction and blockage. Circulation slows down, then pain and numbness worsen. Okay, the third pattern is liver blood deficiency. This surprises many people because in TCM, the liver nourishes tendons and nerves. If blood is insufficient, then the nerve becomes very sensitive and tendons tighten, muscles fatigue easily. Patients may also have stress, insomnia, anxiety, eye strain, And it's very common in people working long hours. This is so liver blood deficiency is related to those chronic ones. The fourth pattern is spleen deficiency and dampness. This is very common, especially if you see swollen hands, heaviness, fluid retention, obesity, and poor digestion. In TCM, the spleen controls fluid metabolism. When we are weak, when the spleen is weak, you can think that the fluid metabolism function is poor and the fluid accumulates. We call it dampness accumulates. Then swelling inside the wrist worsens the compression. It makes the compression worse and the pain will be worse. Okay, and some patients, they told me that stress, when I feel stressed, it makes it worse as well. The symptoms always flare up when I feel stressed. Why? This is the reason. Because stress causes muscle tension, poor circulation, and shallow breathing, and tightened shoulders and neck. The entire nerve pathway becomes more irritated. So carpal tunnel is not always just a wrist problem. Sometimes the whole upper body is involved. Let's talk about acupuncture treatment. We are aiming to improve circulation, reduce inflammation, relax tight muscles, calm the nerve system, and improve nerve motility. We have some very good acupuncture points that we can use. The common ones include pericardium 7, which is located in the middle, and pericardium 6 along the two tendons there, lung 9, and some ash points, which are where you feel the pain. These help reduce the compression, improve local circulation, and of course, relax tendons. We also have some distal points, like large intensive 4 on the hand, some on large intensive 11 in the elbow, and some on the leg as well. So you may wonder why we are using distal points, because acupuncture treats the whole body, the whole system, not only the painful spot. So we are looking human as a whole system, not just the different parts together. Sometimes neck and shoulder treatment matters because many patients improve only partially if you need the wrist alone. That's because the muscles and the shoulder tension and posture, they all affect nerve tension. So often we also treat neck, upper trapezius, pec minor, and forearm muscles to help to relieve the tension and the compression. What else we use in our clinic? Of course, electroacupuncture. You may heard of it. It actually can work very well, especially for numbness, chronic cases, and severe tingling, because it helps stimulate the nerves and circulation. Many patients feel their hand becomes lighter after treatment. That means the heaviness is a bit cleared after that. We can also use moxa and heat if the symptoms are cold, stiff, and achy, and warmth usually helps. Moxa may help improve circulation, but if the wrist is very inflamed and hot, too much heat may aggravate symptoms. We don't use that for very inflamed body parts. The last but not least, the rehabilitation matters as well. Acupuncture alone is not enough sometimes. Patients also need stretching, posture correction, ergonomic changes, nerve gliding exercise. Especially, they have to reduce repetitive strain. So just bear in mind when you have to repetitive use your hand for something. Of course, phone use. Modern phones are a huge issue. People hold waistband for hours, especially scrolling in bed. This continuously stresses the tendons, the fascia, the nerves, and that is a very common modern cause. Okay, please, every now and then, once you use your phone for about half an hour, try to have a rest on your hand. Sleeping position matters as well. Sleeping with wristband worsens symptoms. I'm sure some patients experience that. Sometimes wrist splints at night help a lot. You may try that. It's simple, but it's effective. When it's surgery needed, some patients they might have to go to surgery, but not everyone. Severe cases may require medical referral, especially muscle wasting, severe weakness, permanent numbness, and field conservative treatment. Okay, what patients usually feel after acupuncture? Often they feel warm, lighter hand, reduced tingling, deeper sleep, and relaxed forearm. But chronic cases usually need multiple treatment, especially if symptoms have existed for years. Then why chronic cases take longer, you may wonder. That's because long-term compression causes nerve irritation, scar tissue, muscle guarding, nerve system sensitization. So treatment is gradual, it's not that fast. Well, some important clinical reality, acupuncture can help, but if the patient continue overworking, continue with a poor posture, and continue have excessive phone use and repetitive strain, symptoms often return. Lifestyle matters enormously. Please try to look after your hand, try to reduce the phone use and have good posture, and try to have rest in between repetitive strain. While in TCM, something is not flowing properly and there is a pain. The goal is not only remove pain, it's to restore circulation, restore balance, calm the nerve system, and improve tissue nourishment. Okay, now let's talk about something with emotional component. For many chronic pain patients, they also carry stress physically, especially hands and forearms are working areas. People who type constantly, work constantly, never relax, often have tension unconsciously. Acupuncture helps the body to let it go. There are some prevention tips, very important. Please do have some frequent breaks in between, like I said before. Stretch your forearms, improve posture, and please again reduce phone use, keep wrists neutral, and try to improve sleep and reduce stress. Okay, carpal tunnel syndrome is not just a wrist problem. It involves nerves, circulation, posture, muscles, stress, inflammation, and repetitive pain. Western medicine focus on nerve compression, but TCM focus on qi flow, blood circulation, channel balance, organ systems, nerve systems, and regulation. With acupuncture, we aim to improve circulation, reduce inflammation, relax tendon, calm the nerve system, and support healing naturally. Thank you for everyone for joining today's live stream. I hope this helped you better to understand carpal tunnel syndrome. And I also hope this help you better understand acupuncture and how Chinese medication approach chronic pain differently. Please take care of your hands because in modern life, we use them almost every minute of the day. And thank you, everyone.